Well, hello, and we are very, very pleased to welcome Pam Pillay today. Um, she's been a very active and keen participant in the Medical Law Report project, and she has really impressed me with her energy and enthusiasm and obvious appetite for learning. So I'm really looking forward to interviewing Pam. She's become known to me through her various activities around the Medico-Legal Reports. And Pam, I must just welcome you and tell you that I'm very much looking forward to this interview, and I'm sure we're going to have a great discussion. So welcome, Pam.
Thank you very much. Much appreciated. Advocate Dutton, thank you for affording me a brief audience with yourself, albeit on a virtual platform. Why the interest? Many reasons, actually. I don't quite know where to start because I tend to jump from one topic to the next, but perhaps I should just make it clear as to how it all started. Well, firstly, I'm from KZN. So I was born and raised in Durban. I did my MB CHB at then the University of Natal, and I was very privileged to walk amongst the greats, Prof. Jack Moodley, Bilkis Kassim, Kathrada, Prof. Bhagirathi. It was phenomenal. It was really phenomenal. And I intended to actually stay on, but thanks to marriage, I had to do a little bit of a leap into the Northwest province. And I strangely enough ended up in a very Afrikaans-dominated environment where I actually did my internship. And it was actually very enlightening because I was also transitioning through that period of the pre-apartheid, post-apartheid era. We were very active as well, during our early years. And preceding all of that, I think the most important thing for me was, just growing up, I think, in an environment where I saw so much. I was exposed to a fair amount. And I really have to thank someone hugely great and phenomenal in my life, who's my father, actually, who was a simple man, but he was quite remarkable. I was not born with a silver spoon in my mouth, but when it came to my father, he was a huge visionary, and he enabled the whole activity and discussion regarding, how do we actually balance the scales of justice. He wasn't a lawyer. He was an accountant, but I had a very open-minded dad, and I come from a very proverbial family in terms of diversity. But I'm very grateful to someone who actually supported me and managed to put me onto very stoic ground, because yes, we are working in a very male-dominated environment to date, and yes, MBCHB at UKZN, and subsequent to that, almost immediately into the Northwest province. I did my internship there, got back into Johannesburg, and mainstreamed really to actually go into cardiology as a specialty. And during that time, I was very privileged to actually see our late Nelson Mandela, and yes, very affectionately so as well. He was treated by our team of doctors. So it was wonderful. It was a wonderful opportunity. But I was poached, actually, by the ONG department. And as I said, walking through the great halls, and especially with Professor Moodley, he just leaves an imprint of sorts. I just ended up in the direction of moving forward towards my FCOG, which I did through WITS. And subsequent to that, I became a specialist in the field. I stayed at Chris Hani Baragwanath for about 1.5 years. In the first year, I ran the department with just a sonographer. And we must remember that Chris Hani is the largest sub-Saharan African hospital. So that was a mass opportunity for me to actually get into fetal medicine. And that was really the intention at the end of the day. But I had to make a difficult choice and eventually moved into private practice. And I have now been in private practice for about 15 years plus. And most of my time was focused on an incredible journey of looking after high-risk pregnancies, and I thoroughly enjoyed it. Subsequent to that, it phased out. COVID came into the picture, and I found myself sitting with a fantastic clientele of gynecological patients. Strangely, not 20-minute visits. I never see such patients. My profile's very complex, very complicated, and yes, that's pretty much it in a nutshell in terms of, you know, who I am, where I come from, and so on.
Your background. Yeah.
Yeah.
Now, just all right. Please continue.
So I was actually very close to someone who was a member of SAMLR, Professor McIntosh. And he urged me in 2023 to actually participate in the foundational course. I had no idea of what I was getting into. I think he just saw the fact that, you know, I had that desire, I had that need. I've always tried to practice ethically. I've always seen it as a moral obligation as well, you know, to be a healer, to do that first before anything else. I've always prioritized just in terms of ethics, bioethics. So he saw that opportunity, got me in, no return. Fantastic 2023 foundational course. 8 modules in one go. I really enjoyed it. I profoundly enjoyed every presentation. I found particularly the presenters, including yourself, and that's where I think most of us were just jaw-dropped by the fact that you were a rhetoric textbook. You just spoke and we were just jaw-dropped, and we had no idea of where this was going, because that is really how immensely in awe we were of you. So I'm in no way trying to, you know, gather points of note, but just to make it very clear, you know, the foundational course for me was particularly very important, even though I felt that I was fairly grounded in terms of practicing, you know, in private practice, especially with regards to, you know, being dutiful to patients and giving as much care as possible. There was a lot that I didn't know. And the foundational course really brought things to light, ignited and amplified certain aspects of my you know, of my interests particularly. Yeah, the most important thing was Prof. Laram. He, you know, he was mainly the speaker and chairman, I think. I do believe, at most of the meetings. And what a fantastic gentleman. You know, I didn't even need to go into court etiquette and so on. He was just a complete demonstration of you know, behavioral type of mannerisms. And he just brought it out so beautifully. So that's pretty much it. And then this came along, and I actually got into the narrative test, if you recall, and you asked me a strange question. Pam, what are you doing here? You don't belong here. And then I thought about it, and I just decided, okay, I'm by default here. And I do recall you saying as well that you were busy putting this intermediate level, you know, into a book. And you highly emphasized, and I think so did Advocate De Silva, regarding please get the expert witness guide, and so on. And I really see that tremendous need for there being this intermediate level that you've actually introduced. You know, you're pushing us into getting onto a different platform in terms of we're reaching out for echelon. We are reaching out for something higher, but we need to do so, you know, governed by systems, and understanding as well that we don't know. There's a lot we don't know. You know, the foundational course was very primarily theory driven in my perspective, and it came more from a medical slant. I think on your end, you know, bringing in the legal aspects, it's just a beautiful merge. I believe that integration is absolutely necessary. I love the modules that you have laid out. I have fallen back a little because I'm in full-time clinical medicine, and I am also your digital creator, by the way. I have updated and put up reels on social media, and it's really to put the information out there and to actually say to people, you need to be interested. You need to know that things are changing. You know, as you've mentioned, the legal system is falling behind. But what the courts don't realize is that we are actually falling behind as well, because AI has come in and it's trending much faster than we actually expected. And that was something that I wanted to ask you as well, which I probably will do towards the end. But I think in a nutshell, you know, the foundational course was a fantastic foundation. And from there, I think one can just only get higher and higher in terms of the rungs. I like your concept as well of the brick by brick layering. I like the fact as well that, you know, the exposure, you know, to the legal team is not as robust and intimidating as I thought it was. And the mere fact that, you know, we are constantly being told, look, we need you. And I understand that you definitely need us. The courts need us. You need that intrinsic expert there to actually drive that judgment, you know, in the right
in the right
way,
direction.
so to
You
speak,
see,
in the right
that's
direction,
exactly,
so to speak.
yeah. So that's exactly it, Pam. And yeah, you know, just if I can just pick up on one or two of your comments. You see, the thing is that is, as I said in the first module, that's the essence. It's really the cornerstone of being an expert witness and of expert witness evidence is your relationship with the courts. And by the courts, I mean at the apex is obviously the judge, but then you've got your legal team, the other legal team, and even the other experts, the whole system. There's a relationship that needs to grow between yourself as practitioner and that system. And if you get that relationship right, in other words, if you know how to present yourself within that system, whether you're dealing with your opposite number as an expert or with an attorney or with an advocate or with a judge, so it's things that founded in your integrity, your ability as an expert, technical ability, your character, the way you portray yourself, all of those things, they all come into an overall package. And the judge at the end of the day is looking for that trusted guide, that person to guide the judge through this morass of technical information. And the judges look for all of that, but then they also look for that common sense, practical approach that you went to go back to the beginning of your interview. You know, you talked about some solid foundations that obviously had been bred into you from, and I know exactly the background you're talking about, and we can see from your achievements in life, you've got that. And so if you marry all of those things, and then the judge looks for those sorts of quality characteristics of a human being, and somebody that knows technically what they're talking about and understands the case, and then finally is able to present all of that in a logical way that the layperson, being the judge in this case, can understand, then you really have got all the components of an excellent expert witness. And what struck me listening to what you had to say now, we see all of those components present in you. So there's the expert. Now it's just a question of getting you to be able to grapple with the material correctly. And that is really what we do, is we take you through what are the formal rules, and then we start integrating that at a practical level to do with your expert report and then with your court work. And then we'll have a look at the examples in terms of the decided case law. So I think your points are absolutely spot on, Pam, and everything you've said just gets integrated into those qualities of an expert witness.
Yes, you know, I was told very clearly. I remember Natalie so well, and you know, I still make and keep contact with her, where she made it very clear. Please, first 2 years, don't think that you are able to just step into court. And I've been asked by many people, but why aren't you, you know, in the environment where you can actually start doing a little bit of medical legal work, at least maybe for the HPCSA, for example, lower that administrative burden and so on. And I've made it very clear to everybody, I need to crawl before I can walk, before I get to talk, you know, and it's something that also resonated with something that Benjamin Franklin actually said. And he said something to the effect of, where tell me and I forget, teach me and I remember, involve me and I learn. So, you know,
100%. Very good quote there.
yeah.
Lovely quote.
So, you know, and I'm a huge fan of Epictetus as well, where he goes, if I don't know, I don't know. And that is really something that roots me to the ground. And it's very obvious that, yes, the theory is there. The practical aspects now are starting to, as you say, become more and more forged with the theoretical aspects. But what you want is someone that is solid, someone that is well researched, someone that is scientifically based, but not too scientific as well, because the glossary in terms of medical terminology can be rather, fascinating, but completely irrelevant. So, yes, also the big aspect of, it's not just the neurosurgeons that are highly in the litigious field, it's obs-gynae. So we
Of
are
course,
still sitting with
what
2016
one of the
guidelines.
most one of the biggest fields actually is well, obviously specifically obstetrics. But you know what I would say to you, Pam, just listening to you, and I totally agree with what you say. But I would actually encourage you, now that you've got these foundations and these academic foundations, I would encourage you to venture out and start getting that practical experience. As I've said to you, I can see absolutely no reason why you shouldn't be capable of doing that. You've got an exceptional pedigree. You look like you've got the right qualities as an expert, as a person, and you've certainly got the training now in the specific field of medico-legal work. And to my mind, you are now ready to start taking those steps. I don't think you must be too hesitant and maybe underestimate what you have got inside yourself. And you'll really see that when you go and take that step and you take that practical experience, and you'll see in one of the interviews today, I spoke to a witness who has been through one trial, but has given evidence once. And what actually came up there, very interesting how, this is how a group helps each other. She was talking about her experience within the witness box, and this was Delhi Gumbi. And she was telling us about her experience in the witness box and how that changed her understanding now. She can understand and relate to content in a different way than she would have been able to if she hadn't ever had that experience, because no one can ever explain to her what it's like to go through a cross-examination, to go through giving evidence. So I would encourage you, even if it's just to start writing reports or get involved in the medico-legal field now at a practical level, you certainly are perfectly qualified and capable to start taking those steps. Of course, you don't have years and years of experience within that field, but you have a lot of experience, you have a wealth of experience, and now you've certainly got the guidelines. If you've done the foundations course and you've done our course, you are ready to start taking those practical steps. And I would actually give you that little push and say to you, go and take that step, because then you will start progressing now in your practical experience. And I'd love to see that.
Yes, I would love that too. It's just that I'm completely in love with clinical medicine, and being in full-time clinical medicine completely denies me the opportunity, because there have been a lot of requests coming through as well to take on cases that I think are very meritorious. And it is just such a pity that I don't have the the time. Actually, time is a huge factor on my side. I have been pushed by a fair number of advocates as well. Just start somewhere. And I really don't have a problem with that. It's just that in Johannesburg, Gauteng, there's not really many people to shadow, and I have been very fortunate to meet with a few advocates, and they need to find you the right cases in order for you to shadow them in their chambers. I've never been in court. I'm going to be part of the gallery, shadowing. So the hesitancy is really not the fact that I'm not ready to do the reporting. It's more the fact that time just does not allow it at this point.
Right.
The other thing is that the one big thing that I really wanted to bring out is, why do experts get into the box, and why do we struggle with them? Whether we are examining them or whether we are cross-examining them, I think we need to understand that foundationally we are just very differently wired. We work on the basis of cognitive empathy. We are there to heal patients. We are there to care for patients. So that aspect of who we are is very emotionally driven. When we get into the box, we are dealing with the judicial system, and yes, we are there for the common good. You are there to to ensure that justice prevails, and we are there to ensure as well that justice prevails. But it's two very, very different approaches, and that's the problem. Most most individuals that I've spoken to that have also been in the box have been terrified. They have been completely frozen, numb. They have gone into complete dorsal vagal nerve shutdown. And they've actually said to me, Pam, I will not go into the box again. So, that being said, that's the problem. We are dealing with a very defensive medical practice system at the moment, and that is a huge issue with medicine. I don't believe that we should actually be practicing defensive medicine. I think we should really just be practicing medicine and primarily looking forward to getting the best patient outcome. I believe as well that we should be making more effort in collaborating with the right people. So within the medical field and outside of the medical field as well. So yes, I would like to forge networking with solid individuals on the ground, because I'm very attuned to collaborating with specialists. For example, in my field of expertise, I do high-risk gynecology. I do open abdominal pelvic surgery. So I'm dealing with different specialists all at the same time, and we need to work together and we need to prepare ourselves. Yes, there's inherent risks. Yes, there's unprecedented risks. And all of that is factored into a massive informed consent, probably 10 pages that I go through with patients prior to surgery. But we want that outside as well, So it's tricky. It's tricky because your workload is very high. You want to minimize the load. You want there to be a situation of merit. In obstetrics particularly, I do have a soft spot for the plaintiff, especially when we're dealing with CP babies. I do believe that there is some place for compensation regarding that child, so it's tricky, especially when you are, because that is what the law needs to see, and they don't see that. So when that individual gets into the box, they sometimes are just frozen, and they sometimes actually say things that they don't mean to say. And that is very problematic as well. So it won't match the report.
I think that's a very good point. And one of the sort of never-ending challenges about medico-legal work is it's inherent in its name, right? Medico-legal. So you've got your that big discipline of medicine and the big discipline of law, and it's the overlap between those two huge professions. And where you get that overlap, it's tremendously challenging on all sorts of levels, intellectually, personally. Your education process never stops, no matter how long you've been in the field. And one of the reasons what we do try to do is to provide guidance for people, whether they're coming from the legal or the medical side, but to give proper structure to those first steps that they're taking. And we do try to, in the course, build confidence through knowledge, through knowing that and at least give you a sense of this is the direction you should be taking, and these are the principles that apply. So we do that. Pam, we in our time, it's been fascinating listening to you, and there's just obviously a wealth of knowledge and information, and your personal journey and your professional approach has all been very interesting to listen to. And I must tell you, you're right. You came along at the narrative test, which was our very first webinar. We're about to upgrade and update the narrative test and present that for a second time, and an updated and expanded narrative test. So, I've known you all through all of these sessions, and as I say, your love of learning and enthusiasm has just shone through. It's been an absolute pleasure to get to know you over the year. And then, Pam, maybe just in conclusion, you can give us some concluding remarks, and then as we get to the end of our interview.
So I think in conclusion, we've gone through most of the comments that I wanted to reiterate. The one thing that I think needs governance is AI. It needs governance. It bursts through the seams of the COVID pandemic. That is something that we highly relied on. So AI is nothing new to us. And when we look at AI in the medico-legal environment, the industrial psychologist, together with the actuary, is probably going to look at that AI black box. But the point of AI is that you don't want it taking over your autonomy at the end of the day. There needs to be a sense of governance. There's issues that comes with the benefits of AI. We are also seeing that in surgery that is becoming more and more micro. And as much as, microsurgery is the preferred route, I think skill is required. The certification is required there. There needs to be a sense of governance. We are also dealing with people's privacy, safety, and just a whole other aspect when it comes to the legalities of AI. It's new. The research is still very fresh. There's still a need, I think, to be one step ahead of AI, and to, I think, continually understand the role it actually plays in medicine. It plays a massive role in medicine, and it needs to merge in a way that is going to be conducive, to put into practice, almost on a daily basis, so to speak. Right now, we are using an AI platform, for example. So that being said, we don't want to replace humans with robots, and that is the big trick there, to just avoid that. And that is why I prefer to have hands-on in terms of my surgical experience. I love open work. I love working with different teams, and I really get complete joy and fulfillment when we have good patient outcomes. And I think that in essence is what sums it all, as a medical practitioner. So yes, onwards and forwards, conquer.
100%. Now, and on AI, and you've actually hit the nail on the head. I a few months ago was presenting at a conference, and one of the presenters presented on AI in the legal industry. And I don't know whether you know, but from Pietermaritzburg this year emerged a case dealing with artificial intelligence and using AI within the legal profession to do legal research. And the case was an unusual one, but a very instructive one, because it pointed out the potential pitfalls of lawyers going to AI and not doing the proper work of following through on that AI and checking that the cases referred to were in fact genuine, that they were accurate, that they were up to date, etc. And it was actually, they got into quite a bit of trouble with the judge. But AI certainly has its place. I think it's already so much part of our lives. But I really love what you said, and from a legal perspective, and then you coming from your perspective, from a legal perspective, ultimately where we are with AI is exactly what you're saying. Even from a legal perspective, we cannot replace that human touch and the human gloss that you need to put on that AI. And certainly, I always think it makes a very good servant, but a very poor master. So we must make sure that AI is our servant and not our master. And that, I think, sums up the approach to AI. Pam, it's been a great pleasure, and it's been fantastic meeting you virtually. I get a lot of enjoyment and satisfaction out of these interviews, I must tell you, because I find them tremendously enriching. I find them intellectually enriching, but most of all, I find them personally enriching. I love engaging with my colleagues and with people that are showing an interest in this field. And I know that you've been very active, as I've said, intellectually curious. And I think there's so much about you that we can really admire and honor. And it's been an absolute privilege to speak to you and to get to know you. And I wish you all the best. And what did you say? Onwards and upwards. Absolutely right. I completely support that. And thank you so much, Pam.
Thank you very much. Thanks. Have a lovely evening.
We will chat soon.
Chat soon. Cheers. Bye-bye.
Bye-bye. Bye-bye.